All right, one of my favorites, this is anatomical regions. So let's get started. We're going to use anatomical landmarks, and we're also going to talk about specifically abdominal regions. All right, again, pause the video if you really want to peruse the standards and objectives, but they're here. All right, so the cephalic region. The cephalic region, your head. All right, so we're going to focus on those. So the cephalic region, head. Cranial region, the skull. Okay. Facial region, the face. Frontal, forehead. Frontal, forehead. Orbital or ocular, eye. Buccal, cheek. Otic, ear. Nasal, nose. Oral, mouth. Mental, chin. I always think about thinker pose, thinking. Mental, chin. All right, so let's see if you remember some. Cephalic, what was that? Whole head. Frontal, what was that? Forehead. Orbital or ocular, what was that? Eye. Buccal, what was that? Cheek. Otic, do you remember that one? What was that? Ear. Nasal, what was that? Nose. Oral, what was that? Mouth. Mental, what was that? Do you remember? Do you remember the little hint I gave? Mental. 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 The chin. Plus, you should know cranium, the skull, facial, right? The face. Okay, so what's this one? Buccal. What's this one? Orbital or ocular. All right, so then we're going to go on to the cervical region or the neck. So really, the only region you got to know here, the only anatomical landmark in this region is the cervical or neck. It's also why the cervix in the uterus is called the cervix, because it is the neck of the uterus. So cervical means neck. All right, now we are on to the trunk region. Okay, so we have thoracic, that's the chest. We have acromial, that's the shoulder. It's actually like the point of your shoulder, so that part of your scapula that comes above right here. We have mammary, which is breast. Abdominal, which is abdomen. Umbilical, which is your navel or your belly button. We have lumbar, which is your lower back. Pelvic, which is your pelvis. Coxal, which is your hip. Inguinal, which is your groin. And pubic, which is your genital region. All right, so now let's look at it on a non-labeled picture. All right, so acromial, remember, that's that point on your shoulder. Mammary, breast. Abdominal, the abdomen. Umbilicus, your navel, your belly button. Lumbar, that's your lower back. Pelvic, that's your pelvis. Now these next three are ones that people always get confused, so pay attention. So we have pelvic, that's your pelvis area. Then we have inguinal, which is your groin. So that's going to be a little inferior, a little lower. And then we will get to pubic, which is the genital region. So they go from superior to inferior. So there's pelvic, then inguinal, then pubic. Then coxal, which is your hip. And then you should also know thoracic, your chest. So let's see, do you remember this one? Umbilicus or umbilical. Do you remember this one? That's coxal, your hip. All right, now let's look at your upper limbs. So we have axillary, armpit, brachial, your arm, antecubital, right here, the front of your elbow, your little elbow pit. We have olecramal, which is the back of your elbow. We have antebrachial, that's your forearm. So your forearm. Carpal, wrist. Manus, your hand. Pollex, thumb. Palmar, your palm. Right here, palm. And a digital or phalanges or phalangeal are your fingers. All right, so let's look at those. Axillary, armpit. Brachial, arm. Antecubital, that's your little elbow pit, right? The front of your elbow. Olecramal is the back of your elbow, where it's all pointy. Antebrachial is your forearm. Okay, right, your forearm. Carpal is your wrist. Manus, your hand. Pollex, your thumb. Palmar, your palm. Digital or phalanges, your fingers. All right, so what's this? That's your palm, palmar. What's that? The front of your elbow, antecubital. All right, so now let's look at your lower limbs. We have gluteal, that's your buttocks. Popliteal, that's the back of your knee. Sural is your calf. It sure hurts. Calcaneus is your heel. Plantar is the sole of your foot. Pedal is your foot. Hallux is your great toe, aka the big toe. Digital or phalangeal are your digits, your toes this time, so same term. Tarsal is your ankle. Cruel is your shin. It's cruel to kick someone in the shin. Femoral is your thigh. And patellar or patella, that's your kneecap. All right, so let's go through them. We have femoral, that's your thigh. Patellar, that's your kneecap. Cruel, remember it's cruel to kick someone in the shin. Gluteal is your buttocks. Popliteal, the back of your knee. Sural, it sure hurts. That's your calf. Calcaneus, that's your heel bone. Plantar, that's the bottom, the sole of your foot. Pedal is your foot. Tarsal is your ankle. Hallux is your great toe or big toe. And digital or phalanges are your toes. So what's this? Kneecap, patella. What's this? That's your shin. Do you remember? It's the cruel one. All right, so now we have last topic is quadrants and regions of the abdomen. So we have abdominopelvic quadrants. So you can see they're named very simply, but remember, this is important. They are named based on anatomical position. So they're not named on basing the way I'm looking at them. They're named based on the way that the person who I'm referring to the quadrants on is. So when I look at these, the right upper quadrant, I have to imagine that person standing in anatomical position. So it looks a little opposite when I look at the diagram. Okay, so it's just right upper, right lower, and left lower, and they're all quadrants. So it's 4 quadrants, and they're formed by 2 perpendicular lines, and they cross at the umbilicus. Easy peasy, you know where they are. Abdominopelvic regions, on the other hand, there's 9 of them. Obviously, their names are a little bit more complicated, but they're more precise when describing the location and orientation of internal organs. And doctors or anatomists may prefer to use these terms as they are more specific. Okay. However, for our purposes, we're going to focus on just the quadrants. So here's an example of where a doctor or anatomist might know you are experiencing pain and then what that might mean. Okay, but we're going to focus on only 4 that I want you to remember, and we're going to go through them in just a minute. So we're going to focus on only the abdominopelvic quadrants. So in which quadrant would you most likely, are you most likely to feel the pain from appendicitis? That is the right lower quadrant. Okay, in which quadrant are you most likely to feel the pain from hepatitis? And that's an inflamed liver, and that's going to be in right upper quadrant. In which quadrant are you most likely to feel the pain from constipation? So really your rectum being full and not emptying. That would be the left lower quadrant. And in which quadrant are you most likely to feel the pain from a pancreas or spleen? And that's going to be left upper quadrant. Okay. So again, in class, we'll be doing a Blue-Get for practice because I know that is a lot of terms, but you can do it. You got it. So that's it. That's an overview of the anatomical regions and then the abdominopelvic regions and quadrants. And I hope you learned something new.